Almost 2 years to the day after passage of the healthcare overhaul law, the U.S. Supreme Court will hear arguments about the constitutionality of one of the law's central tenets. This is the individual mandate, the law's requirement that all Americans have health insurance beginning in 2014 or face fines. Here at Bloomberg Government, we've been examining what will happen if the High Court strikes down the mandate. As part of that work, I've done a study of a series of state health reforms during the 1990s. Virtually all of them occurred in the absence of a mandate. I wanted to see what lessons they might hold for the current situation. The state reform experiments are not dusty history. They're already playing a big role in the Supreme Court case. Lawyers for the government are citing them as proof of the need for the federal mandate. In effect, the lawyers have decided what the lesson of the state experiments is. It's that insurance market reforms in the absence of mandates blow up. But is this really what the states show? Before I tell you what I find, let me set the stage. Health policymakers have long tried to reduce the number of people who are uninsured by changing how private insurance works. Two of the big changes that both the state policymakers of the 1990s and the congressional authors of the federal law sought or are seeking is to require insurers to take all comers, or in policy speak what's called guaranteed issue, and to charge everybody the same or similar amounts, or community rate. The idea is that by doing these things, the result will be big, medically diverse insurance pools across which to spread the costs of treating the sick and injured, more people covered by insurance, and a better health care system. But there can be a downside to these changes. They can set off something called an adverse selection death spiral. This is a destructive chain reaction where unhealthy people pour in, costs go up, healthy people exit, leaving insurers with increasingly unhealthy risk pools and still higher costs. The logic of a mandate in such circumstances is clear. By ordering everybody into the insurance pool, so to speak, it binds together what might otherwise fly apart and prevents adverse selection. To examine whether the state reforms experienced adverse selection spirals, I looked for four things: declining insurance enrollment, rising rates, increasingly unhealthy risk pools, and an increase rather than a decline in the number of people who are uninsured. And that's just what I found in the case of some of the states. Take New Jersey. In the wake of overhauling its individual health insurance market in 1993, enrollment dropped even as it was rising nationally, rates rose and at a faster pace than nationally, and as the study shows, the state's uninsured rate went up, the health of its insurance pool went down. But the story doesn't end here, because what I found in other states was little or no evidence of adverse selection spirals. For example, Kentucky, which overhauled its individual market in 1994, seemed prime for adverse selection. But virtually all of the state's insurers quit the market before the process had a chance to get underway. The insurer's exit surely is evidence of market disruption in the aftermath of reform, but it's not clear evidence of adverse selection. I estimate, for example, that enrollment in Kentucky's overhauled market may actually have risen slightly after reform rather than fallen. In still other states, there doesn't seem to have been much disruption at all. Now, what are the implications of my findings for the Supreme Court case? At a minimum, they are that the state experiences of the 1990s don't offer the kind of uniform, incontrovertible evidence that overhauls in the absence of mandates blow up. Sometimes they do, but sometimes they don't. On a grander scale, the mixed results suggest that there may be life after a mandate. The overhaul of America's health insurance markets may be able to go forward even if the Supreme Court strikes down the mandate. It will no longer occur in headline-grabbing legislative triumphs or historic court decisions. Instead, it will play out in thousands of small skirmishes along the borderline between the old insurance system and the new one that the 2010 law seeks to bring into being. For Bloomberg Government, I'm Peter Gosselin.